We are at the NNC Specialty Hospital, and we're going to continue with the surgical insights. We're going to be speaking with Dr. Muddazir. He's going to tell us all about ENT health, how to prevent it, and how to take care of ourselves. Doctor, how are you?
Hi.
Perfect.
Good afternoon. Yeah.
Good afternoon. Doctor, what inspired you to pursue ENT as your specialty?
If you ask this question, I would honestly tell you my father was my inspiration to take this fantastic field of ENT. When I cleared my entrance and I was in the selection process, he was the one who inspired and he motivated me to go for an end specialty like ENT, which I'm very truly grateful for.
Perfect.
Yes.
So you love your profession.
By the grace of God, yes.
Amazing. Okay. So now let's talk about Dubai and ENT health, right? Like, because we have obviously particular lifestyle changes, meaning that we have air conditioning in really high, very cold everywhere. Because of the summer, we drink a lot of cold drinks. How does lifestyle affect the ENT health?
If I have to talk about the cold, anything with cold beverages, which is sugary or non-sugary, any cold drinks can affect the throat lining right from the beginning. If you start, it can affect the throat lining, resulting in pharyngitis, throat pains, and infections and all that. And if you look into the sugary beverages, especially, it can affect the tooth. It can decay. It can cause tooth decays, and it can affect the enamel. It can. So, and going down, this very cold beverages can slow down your digestive process, you know.
Correct.
And can upset your stomach. So, this is one side of it. The other side of it, like, sugary beverages can put on your weight, and you can end up in increased weight as well as diabetes and other diseases like that. So, overall, the sugary beverages as a whole, and because of the high caffeine and the high sugar content, it can have impact on your health.
Okay.
Yeah.
But do you think that very cold drinks can also have an impact on your throat health?
Of course, yeah.
Yes.
It can affect the lining, and it can in any cold items, especially those who are not sudden in this hot weather. You tend to take sudden gulp of a lot of cold beverages, which can end up in infection in the throat and even in the sinuses.
Okay, perfect.
Yes.
So you recommend that maybe room temperature drinks are definitely better?
Always, but once in a while it's okay. Excessive,
Okay.
Yeah, especially those who are not used to it. If they try to gulp a lot of cold beverages, it can end up in sinus infections, yes, and throat infections.
Okay, good to know. Now let's talk about the environmental issues here in the UAE, right? We have the sandstorms, we have all these allergens and everything like that. How do you see those being impactful into the residents of the UAE?
Basically, the primary root cause of all the issues, I would say, is the dry air, which makes the the air passage, the airway, make it very dry and prone for infections. And if you look into the allergic aspects, all the dust is the primary cause. The dust here on accompanied along with the AC, and all this is a true allergen which can cause recurrent allergic infections to the patients.
Okay.
Yes. On the other hand, the humidity, the ear also can get infection because of the the canal become moist, and it can get fungal infections and all that.
Okay,
yes.
Perfect. So what would be a few things that the residents of the UAE can do to prevent these kind of irritations and infections regarding, the dry air is out there and the moist is obviously part of the environment. What kind of things we can do as residents to prevent these kind of infections and take care of?
If you ask me two key things, I would recommend using a humidifier or a humidification of the air.
Okay.
And drinking plenty of fluids, plenty of water.
Mm-hmm.
These are the two things which I give advice as an ENT health is concerned.
Okay.
Yeah, apart from your routine care, these two things in addition would definitely help a patient.
Okay, perfect.
Or any person, yeah.
Okay, now let's talk about allergies. Is there any particular allergies that you see developing more here in the UAE compared to other places maybe?
In general, allergic patients, I feel, I'm an Indian, when compared to India, I feel the allergic patients are more in the UAE.
Mm-hmm.
Yes, might be because of the weather and the constant usage of AC and car-to-carpet life.
Yeah.
And more association with pets, People have in a closed environment. Not having pets is not the issue. having pets in a closed environment could be another cause.
Now let's talk about sinus and sinus infections, right? Because another thing is difficult sometimes to see when it's a sinus infection and when it's an allergy. How can a person know what is the difference between those two?
It is basically based on the symptomatology. Because symptomatology of the allergic rhinitis is different. It's mainly patient presents with runny nose, sneezing, itching. Whereas in chronic sinus infections, they come with nasal block, headaches, heaviness in the face and head. It's altogether two different set of symptoms. You can have combination of both where it is little confusing. And on top of the history taking, you do an endoscopic examination, which will give you a clear-cut idea of what's going on. Yes.
Amazing. Doctor, and I also know you have managed cases like a skull-based surgery. Could you share some of the biggest challenges when you're doing a little bit more in-depth of the ENT health?
Anything. See, the skull-based surgery, we normally associate with the neurosurgeons.
Okay.
And we don't do it alone. We always associate with the neurosurgeons. And the basic challenge is removing the tumor is not more than the removal of the disease. It is the closure, because we are leaving behind an open space in the skull base, which is not allowed. You know, you have to close it. It should be a good seal. So that is where the challenge happens. For which, but once you have the proper training, proper equipments, proper instrumentations, and with good knowledge and skill, it has become much easier when compared to the former era.
Okay, now let's talk about the equipment and technology, right? This is something that has changed the medical field. Tell us, especially in your profession, what are the biggest advances that you are more excited about when it comes to the treatment of some of the conditions of ENT?
Yes, at the outset, I would like to say ENT is one field wherein the technology has revolutionized the treatment of ENT. ENT conditions. Right from, if you ask me to name 2-3, the excellent endoscopy camera systems, the microdebriders, and co-ablators. These three things, these are three things which have literally revolutionized the treatment of ENT care. Especially in the nose and the ear conditions.
Amazing. So definitely technology has helped you advance and everything
Very
like
much.
that. Okay, good. And there's something very, when I was reading about it, I was like, this is something that a lot of people don't talk about, but maybe you see this in your practice, which is the DCR surgery for tear duct blockage. Tell us how a patient knows, because it was, again, when I was reading about it, I was like, oh, that sounds very interesting. I wonder how common that is and how people know there's some kind of blockage in there. What will be the symptoms so they can come and see you?
Endoscopic DCR or the DCR it's a condition called, to make it very simple, it is like watering from the eyes. This is a condition which causes watering from the eyes. It's called dacryocystitis. So this is one area wherein we and the ophthalmologist or the eye specialist associate closely with each other. Because this kind of patients are referred by the eye surgeons. Or by the eye specialist. They are the one who refer to us. And why they are referring to us? Because before they used to do it, the correction of this problem by cutting open externally, making an incision externally. It is very much painful for the patient. With the advent of the endoscope and the high resolution camera systems, we are able to provide altogether different solutions, scarless, through the nose.
That's a huge difference. That's a big
difference.
Yes,
The problem is these kind of patients needs to be referred by the ophthalmologist, by the eye specialist, so that we can treat them. That is how, yes.
So the person probably will have a lot of teary eye, and this is actually a blockage of the duct.
Normally, when we are normally sitting like this, only when we cry, we see the tears coming. Even otherwise, the tears are being produced, but it is being channeled through the duct into the nose. When you cry, it is an excess of fluid which tends to trickle over to your cheeks, and it comes out as tears. So once it is blocked, it happens even in the normal scenario.
This is very interesting.
Yes.
Thank you, doctor. I'm very happy that I asked that question. I was like, okay, perfect. Okay, so now let's move into maybe a little bit more for the kids and for the adenoids and tonsils, because this is something when I was growing up, and I guess it happens to a lot of people, but especially here in the UAE, you hear that a lot of children have the tonsils and that kind of surgery. So let's talk about, first of all, when do you know a young patient is needed for this kind of surgery? For removing the tonsils or the adenoids? When do you know the patient needs to have them removed?
Again, the decision is based on the symptoms and the degree of suffering by the child.
Okay.
So if a child is coming to us with a chronic history of recurrent nose block, difficulty in breathing, noisy breathing, mouth breathing, snoring at night, and he doesn't feel fresh after a good sleep, that is when we suspect adenoids in a child. Whereas tonsils is very straightforward because you get recurrent throat infections and fever and all. So it's all the symptoms and what is being suffered by the child.
Okay.
And based on the investigations like the nasal endoscopy, we have the x-rays, all this will help us to identify what is enlarged. For some kids, it's only the adenoids which are enlarged. For some kids, it's both adenoid and tonsils are the culprit. So based on which we suggest the medication, the treatment in fact.
Okay.
Normally again, these kids are treated primarily by the pediatricians. So when a medical treatment fails, they refer such patients to us for a surgical management.
Okay.
So when we see a patient like that, we assess the history, we assess the severity of the symptoms, and along with our examination, we suggest what is the best treatment for the patient.
Okay.
Yes, and such kids also do suffer from a different area of symptomatology like decreased hearing. So it sounds like it is not connected, but it is very much connected because an enlarged adenoid can block the eustachian tube, a tube which connects the middle ear to the back of the nose.
Oh, wow. Okay.
So yes, when the fluid builds up because of the blockage, the child starts to suffer from decreased hearing as well. So then it's a warning sign, something is, the adenoids are really fully large.
So what would they be the main symptoms that the parents need to know in order to say, okay, my child may need to have adenoids, checked? What would be the main symptoms?
Very, very good question. See, this is one thing which any child who is not getting a good relief from a symptoms like, recurrent nose block, difficulty in breathing, difficulty in sleeping as well, mouth breathing, he always keeps his mouth open, and he makes like a literal snoring, he makes noisy breathing while sleeping. All these are the trigger signs, which should make any parent alert. We should always get a pediatrician opinion or an ENT opinion. But normally, being a child, everybody gets a pediatric opinion. Normally, there are many medications which have been tried to alleviate the symptoms, like nasal sprays. And despite trying for a couple of months, if the child doesn't get relief, then it's a warning sign. You should go for something which is going wrong, which is not getting medically improved.
Okay.
That is when they should be referred to a ENT, and or they can a parent who are aware of it normally comes to an ENT for a detailed evaluation, wherein we do an nasal endoscopy and we can do x-rays to assess and make a decision for the patient.
Okay, perfect. And lastly, to give these parents a little bit of peace of mind per se, how much advance we have in these kind of surgeries that we have to perform to remove the adenoids and everything like that? How much simpler the surgeries are right now that they give the parents a peace of mind knowing if they have to go to surgery, it's not going to be too bad?
Absolutely. With the help of the current technology we have, the adenoid surgery, we even tell the patient, the child won't even know why he has come to the hospital in the first place, let alone the pain and suffering.
Good.
Yes, adenoid is that painless if performed well.
Amazing.
Yes, whereas when it comes to tonsils, of course, it is in the food pathway, so patients do get pain. But as far as a child is concerned, the healing is much faster, the pain is relatively less when compared to an adult. The beautiful part of the surgery is like we let the patient, a child, eat any number of ice creams and anything cold,
They love
like a dream come true for the patient.
Okay.
So the child, when they heal, you can see the smile on the face. I'll tell them you can eat any number of ice creams after the surgery. Yes, then I'm ready for it.
Okay, good.
This is the normal response of any child,
Okay, perfect. So good to know for the parents out there that if they need this kind of surgery, it's going to be minimal invasive and the patient is barely going to feel anything.
Yes, it is good.
Amazing. Okay, doctor, to get to know you better, we're going to go to the rapid fire questions. So I'm going to ask you questions quickly and you're going to answer the first thing comes to your mind, okay? So we're going to start. One ENT tool you cannot live without in the operation room.
Endoscopes.
Perfect. Your favorite minimal invasive ENT procedure?
In a child, of course, this adenoid surgeries.
Okay. Tea, coffee, or water for sore throat?
I prefer water. Warm water with a little bit of honey and lemon.
Okay, perfect. So
This is my choice.
all recipes still works. Amazing. One quick tip for ENT recovery in Dubai's climate.
Again, humidification and good hydration.
Okay, good. The most common myth about sinus surgery.
Many of the patients feel that doing the sinus surgery is a one-shot solution to all of his problems, but it's a myth. It is just a part of the broader management of sinusitis. It is not like you do the sinus surgery, your job is done. No, it is just one part of it. You remove the polyps, then you take a medical management so that the problem doesn't recur.
Oh.
Yes, it's
Very interesting. I would have thought that the no surgery will cure it all.
yes. We make it very clear to the patient because patients should have a realistic expectations before going for a surgery.
Okay.
It's a very good question you posed.
Okay,
Yes.
no, that's a great answer. Thank you, doctor. And what is a non-medical hobby you enjoy?
Photography or.
Oh, very interesting. And last one, doctor, best advice for parents about their child's ENT health. How do a parent can take care of the child's ENT health?
My advice would be to consult a proper doctor like pediatrician or an ENT whenever symptoms doesn't improve.
Okay.
Don't try to don't wait unnecessarily. You should be very alert because certain conditions can affect, for example, for a simple example, adenoids. If you keep it untreated, it is ending up in complications like ear infections, fluid getting built up in the ears, ending up in decreased hearing and all future ear issues. So when you feel things are not improving, you should always be alert to meet a doctor, specialist.
Perfect. Amazing. Okay, that's a great advice, doctor. Thank you so much for being here today. Pleasure speaking with you, and we'll see you soon.